Welcome to the Standing Committee on Health and Social Development. Today is Friday, December 10th, 2021. And my name is Gordon McNeely. I'm the chair of this committee, and I want to welcome the members of the committee. We have Zach Bell, Sydney McEwen, Rob Henderson, Carla Bernard, Michelle Beaton, and visiting is Lynn Lund here today. And just before I ask for a motion to adopt the agenda, there's some issues with microphones, so we'll go a little bit slower. So letting the committee members know that we'll probably slow that process down a little bit because there were some issues there. So saying that, can I get a motion to adopt the agenda? Sydney McEwen? So we're going to receive a briefing on drink spike incident in Charlottetown from the Charlottetown Police Services. I'd like to welcome our guests, and what I will do is I'll pass it over to you, and you can present as you see fit, and then after that we'll just ask questions at the end. So we'll ask you to introduce yourself for Hansard so it gets on the record, and then you can begin with your presentation. Welcome.
Okay. My name is Jennifer McCarron. I'm currently the acting deputy chief in charge of the Major Crimes Unit at Charlottetown Police.
My name is Tara Watts, and I'm currently assigned as a detective in the Major Crime Unit at Charlottetown Police Services.
Okay, so first of all, I'd like to thank the committee for having us here today to discuss this important issue. We appreciate the interest the committee has shown, and we'd like you to understand that we take each of these incidents very seriously. We take a more victim-based approach when dealing with these incidences. We appreciate the opportunity to be here and help everyone fully understand the role of our investigators in these issues. We have prepared answers to the 3 questions that were given to us, and I'm going to turn it over to Tara to answer the first question.
Great, thank you.
So the first question that we received was, how does Charlottetown Police Service respond to complaints of this nature, and the processes and policies in place to investigate these complaints? So I'm going to kind of take you through what that investigation process can look like. So we do have internal policy with respect to any report that has a sexual violence component to it. It would be reassigned to and investigated by the Major Crime Unit. Initial contact is made by a patrol officer in uniform and then reassigned once the basic details are obtained. Victims are expected to be treated with respect and dignity during all stages of the investigation. With respect to administering a noxious substance, which is defined in Section 245 of our Criminal Code of Canada, it states everyone who administers or causes to be administered to any person or causes any person to take poison or any other destructive or noxious thing. These files are sometimes investigated by the Major Crime Unit, depending on the circumstances. It's important to note that 93% of our files within Charlottetown Police Services in the last year are files which were reported. They're directly associated to one individual in Charlottetown. And it should be noted also that we continuously work with community resources to assist this individual with their mental health. Administering a noxious substance investigations are not new to our department. In the past, we have investigated reports and cases were successfully prosecuted. In 2007, a male was convicted with respect to a drug-facilitated sexual assault, including the offense of administering a noxious substance. This individual was sentenced to 4 years in custody. As any other investigation, the starting point is a formal complaint, including a formal statement. For various reasons, not everyone reports these incidents to police. Sometimes a report is made, but the complainant does not wish to provide a statement or any further investigation, but simply wants it documented for information purposes. When an official report is made, investigators ensure the collection of any available evidence. This could include forensic evidence, for example, a sexual assault examination kit, along with a blood and urine kit. Those samples are collected if appropriate. Secure the crime scene if necessary. Obtain statements from victims and witnesses. potential video surveillance. It should be noted that often systems are purged after days, not weeks, at our local businesses. If a suspect is identified, then he or she would be arrested if reasonable and probable grounds exist. The officer must believe the person has committed a criminal offense. This has to be more than a hunch or suspicion and must be based on reliable information. If the individual is arrested and released and not held in custody, then conditions could be put in place at this time to ensure safety of the victim and public. It's also important to understand that arresting and charging someone are not the same thing. Just because an individual has been arrested does not mean that they will be formally charged. Which takes us to the next point, that all sexual assault investigations require a pre-charge review by the Crown Attorney's Office to determine if there's a likelihood of a conviction. The Crown Attorney's Office requires a full and complete investigation from police prior to making that determination. This oversight came into effect on PEI in 2018. If there is not a reasonable likelihood of a conviction, Victim Services will often assist in scheduling a meeting with the victim service worker, Crown Attorney, and the investigating police officer to discuss the outcome. If there is a reasonable likelihood of a conviction, then an information is laid before the court, which initiates the court proceeding. This means that the individual has been formally charged. We are very fortunate here on PEI to live in a jurisdiction where we have such a close working relationship with our stakeholders, such as Victim Services and the Crown Attorney's Office, and to be able to have a collaborative approach to deal with these very complex issues. We are happy to hear that the committee has asked to meet with Victim Services and the Crown Attorney's Office because we definitely feel that their perspective is important and matters. So hopefully that covers number one.
The second question was, does the Charlottetown Police have any plans to improve its response to these complaints? We are always striving to improve our organization, and we need not only focus on how we respond to these complaints, but how we work preventatively to keep these crimes from happening in our community. CPS is currently in the process of preparing an MOU with the PEI Rape and Sexual Assault Center with respect to a file review on all our drink spiking cases, and we welcome that. Any oversight that can give us, direction or, ways to help us deal with victims, we totally invite them. Our drug enforcement unit focuses on preventing the sale of illicit drugs in our community. The most commonly used in drug-facilitated sexual assaults are Rohypnol, or roofies, GHB, which is also known as liquid ecstasy, it's gamma hydrobutyrate, and benzodiazepines. Sometimes the effects can take effect within 15 to 20 minutes of the drug being administered, and some last 24 hours, some last 3 to 6 hours. So it's really important when it's reported that we get the victim to the hospital to have these tests done, or they go on their own. We've seen the presence of these drugs in some of the seizures by our drug unit, and we focus our efforts on preventing the trafficking in illegal drugs in our community. We also have a prescription drop box at the police station where people can come in and dispose of their unused medications so it doesn't get into the hands of people to be used unlawfully. We are enhancing our training within the department. We see value in ensuring that our officers, especially those investigating the sexual violence offenses, are trained in trauma-informed approach to policing. We use our crime analysts specifically to track the drink spiking incidents, whether it falls within a sexual assault investigation or on its own. And we focus on we're focused on an education piece to ensure that people understand what to do if they think their drink was spiked. The emphasis must be on immediately seeking medical attention so that any evidence of a potential offense is not lost. The ability to detect drugs in one's system can range from hours to months, depending on the type of drug and the manner in which it was given. as well as how it is collected, blood, urine, and hair samples that are collected by the medical staff at the QEH. Want to handle the third one?
So the third question is how Charlottetown Police Service intends to assist island businesses in preventing, detecting, and reporting incidents of drink spiking. So we feel that not all efforts should be reactive and recognize that we need to be proactive. We feel that education and public awareness is an important part of crime prevention, and our department has recently started working with other police agencies and various community organizations to create a public awareness campaign related to the issue of drink spiking on PEI. And from what I understand, that is going to be released.
Yeah, we
soon.
have had meetings with the Liquor Control Act, the Rape Crisis Center, Charlottetown, Summerside, Kensington Police, and the RCMP to do a campaign on awareness of, the potential of drink spiking at the bars. Our officers have also talked to the bartenders and owners of the bars in Charlottetown to advise them that this is going on, and for them to do their due diligence at the bar.
And just in closing, so those were the three questions. So in closing, we do also want to express our concern over recent media reports suggesting that there's a lack of police interest in investigating these complaints. This message can be extremely harmful to our community by potentially deterring any victims of crimes from reporting. And that should be concerning to everyone in this room and anyone watching here today, because that message is simply not accurate.
Thank you very much for your presentation. We'll just open it up for questions at this time. So, Sydney?
Thank you, Chair, and thank you both for coming in. You had mentioned in your presentation about a review of the drink spiking cases. Is that basically like a review of all unfounded cases that the Charlottetown Police Service has? And can you expand on that more? Like, who would be doing that review?
Okay, do I put my hand up to answer?
Yes, go ahead. Yeah,
So we have met with the PERSAC, and they had requested that they have access to our files to review any of the drink spiking cases. So currently, we're working on a memorandum of understanding with them, and we'd like Victim Services and the Crown involved as well for the review.
Sydney?
Thank you. That's the Rape and Sexual Assault
Yes.
Center, that's what you said, yeah. So you're working on an MOU with them, and they would do the review of unfounded cases?
Yes.
Sydney?
So would they be doing that internally? Would they be hiring to do that?
The details haven't been worked out yet, but I do believe it is the staff from the Rape and Crisis Center.
Sydney?
Is there like you say an MOU, is there like a terms of reference? Like what do they intend to, I guess, gain? Is there potential for cases to be opened back up from this? Like how was?
We're still really in the infancy stage. We haven't really met to discuss the MOU yet, but we'll have more information when we have our next meeting.
Okay.
Sydney?
Thank you, Chair. When you had met, I think you said you'd met with, obviously with the Rape and Sexual Assault Center, since all the cases had come forward this summer. What did you learn from that meeting? And is this one of the things that came from that?
We haven't met face-to-face yet.
Okay.
It's more of, I believe it's Rachel Crowder came and met with the chief, and they had an agreement to meet to go over the files.
Sydney?
I think that's an important thing that the city police is going to meet with the Rape and Sexual Assault Center, but you said it was with the chief and it was more about the MOU on what they're going to do to review the files going forward?
I guess it was kind of the initial stages of them asking if it's okay if they come to the police station to go over the unfounded files. So that was the initial meeting, and then I'm going to meet with Rachel, and we're going to create an MOU between both so that can happen.
I'm good for right now, thanks.
Okay, good, thanks. No, I just wanted to clarify, Lynn Lund is an official member today, so she's substituting for Michelle. We'll let her go with the next set of questions. Thank you.
Thank you, Chair. I appreciate that. And thank you both for coming in today. This is an incredibly important topic, and I'm glad we're going to have the opportunity to unpack this a bit. There's been a lot of questions that have come to me from victims, from people who have reported their crimes, not just in Charlottetown, but across the province. So I appreciate you being here, but I just have two quick clarification points that I'm hoping you might be able to help me with before we start. You had indicated something to the effect that 93% of cases pertain to one individual. Mm-hmm. I don't know what you mean by that. Do you mean that 93% of the cases that come in are reviewed by the same officer, or do you mean a member?
No, it's the same person that calls.
Oh, I see. You've had 93% of cases on sexual assault have come from the same victim?
No, the administering of the noxious substance have come from one individual.
Got it.
Okay.
That is more clear to me now. Thank you for that. And given the gravity of the situation, and as Sydney was indicating, it sounds like the initial conversations with PeerSAC happened with the chief. Is there a reason the chief isn't joining us today?
Not that I know of.
Lynn?
Thank you, Chair. Perhaps I am the one who originally sent the letter requesting it, so perhaps I should have been more explicit in asking the chief to join us. I just assumed he would be present for this discussion. I don't know that you'll be able to answer all of the questions that I have, but perhaps we can just start with some of them and see if we need to have a second meeting or not. But I have heard from a lot of people who have come forward when they have believed that they were drugged. And I'm curious if you can just walk me through the process. You went through sort of the policy of what that looks like when someone comes forward to make a complaint. But I'm just curious if you could walk me through this. I come into your office, I let you know that I believe I have been drugged or sexually assaulted. What happens next?
So, and I kind of talked about that. So depending on the passage of time, so if that was appropriate, the first step would be to collect any physical evidence. Okay. Any forensic evidence is always the most important. We don't want to lose that evidence. So going to the hospital is the first thing. That would be the most important thing, is if there's any evidence there to collect. That's why these cases, and I feel like we're talking about drink spiking, but we're also talking about sexual assaults in general. And if there's an element, if someone believes that their drink may have been spiked, and whether it's with respect to a sexual assault investigation or not, regardless, that's the first step that we would want, is for that person to attend the hospital as quickly as possible. We don't collect the blood and urine samples. That's done by medical staff, and so that's priority. As I had indicated before, as any other investigation, the formal report is the first step. So if we're going to be investigating that further, we would need a formal statement from the complainant, the victim in the case.
Lynn?
Thank you, Chair. I have two sort of points off of that, so I'm going to put a pin in the hospital one and come back to that, and we'll go back to the interview, the formal complaint process. I have spoken to a number of people who have gone through this, and they have been interviewed. They've been asked a number of questions. I'm curious if the questions that individuals are asked are standardized, and if they are, if you could give me a sense of what those questions would look like.
So we have formal interview training. So any interview would start with open-ended, like pure version. Because we weren't there, we need that person to tell us what happened in detail from the beginning to the end. And then throughout the interview, then we would kind of funnel in on important details. Details are very important in these investigations, and so interviews can be very difficult, and they can be lengthy. Like some of my interviews last 1 to 2 hours or even more, depending on the circumstances. So yeah, unfortunately, they can be very difficult for people to come in and talk about what's happened for various reasons. So.
Lynn?
Thank you, Chair. Yeah, absolutely. And of course, those processes are going to be long. And I know there's been a number of requests from groups that are focused on victim-centric care for those interviews to not happen in interrogation rooms, to not happen in a setting that makes you feel like you are on trial. I'm just curious if you could give me a sense of where these
So-
interviews are happening.
You want me to answer that? Okay.
Katera?
Sorry, my mic's gone.
Yeah.
So I work in the major crime unit. So our unit specifically has what we call a soft interview room. And so that is a completely separate area from our secure rooms where we would do interrogations or oftentimes witness statements. So this room would be, a very comfortable setting. Sofa, comfortable chair, it's very basic, but it's a comfortable room. It's a soft interview room, and it's specifically for victims of crimes.
Lynn?
Thank you, Chair. That's really good to hear, and it's certainly something that we've known the community was asking for across the province, so that's great news. I've heard from a number of people who were asked questions pertaining to things like, what were you wearing? Is that still part of the standard interview process when we're talking about a sexual assault? And if so, can you help me understand why that would be?
So that potentially could be very important information for us to have. If there's any physical evidence that could be collected from that individual's clothing, then because, like, let's say someone was a victim of a sexual assault and there's potentially, and that person had changed. Maybe that person had changed prior to going to the hospital or attending the police station. Every circumstance is different. But if there's potentially the presence of DNA on that clothing, then that's important for us because that would be something that would have to be seized for the investigation.
Lynn?
Thank you, Chair. And I can appreciate where you're going with that, but that feels like a different question.
Okay.
It feels like the question to that would be, could you provide me with the clothes you were wearing at the time so we can scan it for DNA evidence, instead of, could I have a physical description of what your clothes looked like? Feels like a different question if you are a victim who feels like you are being blamed for your crime. Can you understand where I'm going
Oh,
with that?
100%. Like if someone asks you what you're wearing, what does that have to do with it? It has absolutely nothing to do with it. And it may be the way the officer might have asked it when he was actually, or she was actually saying, I need to know what you're wearing so I can collect your clothes. Yeah, I can see where that could get misconstrued.
Lynn?
Thank you, Chair. I know I have a lot of questions. If you want to move around, you can put me on the bottom of your list after this one, if that's okay.
Okay.
Thank
Is that
you.
Yeah, okay. So we will, are you going to ask this one?
I'll just
Okay,
ask
go
this
ahead.
one
Yeah.
follow-up question. Is there a standardized list of questions that people are asked when they are interviewed after a sexual assault or a drink spiking that we could be aware of? Is there basically a standardized form, or is it at the discretion of the officer?
You go ahead.
Okay.
Tara?
So when we talk about, there's not a standardized list of questions. But the questions that we would frame would come from that narrative from the person that we're obtaining the statement from. So obviously you have to determine who, what, when, where. Like that's questions that are standard. But depending on what's described to the investigator, that kind of forms our questions throughout the interview.
You can put me on the bottom. Thank you, Chair.
Carla?
Thank you, Chair, and thank you for coming in today to chat with us about this. It's obviously an extremely important topic. There were two things that you commented on that I'd just like to ask some questions on. So you were talking about enhancing training for officers, and is that something that you've started doing already, or is that something that's kind of in the works?
We try to have standardized training right across the board. But in a lot of the times when we have new officers come on, they don't get the interview course right away. It's kind of like it's a build-up. And the officers that work in major crime have years of experience, and they're specialized training in how they interview Usually within the first 5 to 7 years, we try to have each officer have an interview course, because you have to learn, there's sort of basics in policing you have to learn before you kind of can move on to the next level. So it's not until, officers are ready maybe to move on to another unit that they get the specialized training for each unit.
Carla?
Thank you, Chair. And so at what point in that interview training would the trauma-informed part come in?
It's in most training now, in mostly all interview courses that I know of, it's part of the training now, where years ago it wasn't. It was more, what questions do you need to know? What notes do you take to go back to clarify things? I think probably within the last 10 years, it's more of victim-focused, trauma-based, that you're not re-traumatizing the victim, because they do get traumatized over and over again for this whole process.
Yeah.
And, I mean, we have to ask the hard questions. We don't like to have to ask them, and I'm sure they don't like, but you do, and it's all on a soft approach, that you have to understand that when they come in, they've been traumatized. We have officers like Tara who are extremely good with victims, and we have other officers that are as well. Some people need to be taught how to ask the questions so it doesn't come off, and embarrass the victim, but that does take time. So.
Carla?
Thank you, Chair. And I'm curious, kind of, I have specific questions on the training materials used and how much time is spent on that, but I'm guessing you probably don't have that information.
We can try.
So are you specifically asking about the trauma-informed?
Yeah.
So I've had that training twice. So once was back in, I'm gonna guess 2017. That was pre-COVID and was in person, and I believe that training was 2 or 3 days. I received that training again this year, and because of COVID, that was online, and it was a full day session.
Carla?
Okay, thank you, Chair. And do you happen to know the name of the program that was used?
I believe it was trauma-informed policing, and then understanding the neurobiology of trauma, I think.
Yeah.
Okay.
That's good. Carla?
Thank you, Chair. Thank you for that. The former counselor in me always likes to know those things. And so I'm looking at this from a trauma-informed approach. So if I consider this from the police officer's perspective, going into or interviewing someone in a case like this, and I guess I'm kind of wondering, I might have a hard time getting to the question here, but wondering how, when you have such high numbers of unfounded cases, when you understand how difficult it is in the end for a survivor to have any sort of justice, how does it feel as an officer when that call comes in? I guess this might be more on a personal, or if you've heard stories from people, kind of I'm trying to get a feel for what that's like when that comes in, knowing all of these things.
I know when I was a investigator with the Major Crimes Unit, you never go into an interview thinking about unfounded cases. Your main focus is that victim. Find out what happened and what you can do about it. I know personally I wouldn't think like in a defeatist way. It's just, yes, these are really difficult to investigate, but you go in thinking you can solve the world's problems, and sometimes you can and sometimes you can't.
Tara?
I would like to add to that. When you talk about, Carla, the unfounded and the high percentage of unfounded, I'm not sure if that's an accurate statistic. Our police reporting system had changed in 2018 because of this concern, that there were so many unfounded cases all across Canada, not just PEI. And so there was changes made at that time, and I think they were implemented in early 2018, that gave investigators more options on how to clear cases. So before, we were very limited on the options that we had. Now, it could be anything from the victim or complainant does not wish to proceed with further investigations, because that's oftentimes that is the case. Or you don't have a suspect identified, or there's insufficient evidence to proceed. It's not that we don't believe that that happened, but the evidence is not there. Or it could be that we recommended charges, but they were declined by the Crown. So since 2018, I think you would see a dramatic difference in the case and the amount of unfounded cases, especially on PEI.
Carla?
Thank you, Chair. That's interesting and good to hear that we are moving in the right direction. And the reason that I was asking the question about how you personally felt when that happened is because having trauma-informed training is one thing, but if there's something that you think, oh my goodness, like we're going through this person's going to have to go through this, and maybe in the end this is just kind of that stress that can happen from things that happen over and over again to you. So as an officer, having the trauma-informed training is sometimes overpowered by the system and overpowered by knowledge of how things could go. So I was just kind of trying to get a feel for that. And so I'm wondering, the current system, and so considering not just from the interviewing process, but the whole process when a victim comes forward, in your opinion, is the system well set up to support survivors and to support survivors in seeking justice in the whole scheme of things, not just the responsibility of the police officer?
Tara?
So I think we can definitely do better, not just from a policing standpoint, but other areas. I believe we've heard that there's a 1-year waiting list for someone to speak to a counselor at Rape and Sexual Assault Center here in PEI. I think we need to do better. But like I stated earlier, we're so fortunate to live where we live and have that close relationship with victim services and the Crown, the Rape and Sexual Assault Center. And, if we feel that there's a need, victim services, and I know you guys are going to hear from them later, but they do excellent work in keeping in touch and trying to put any services in place that they can to assist. So, but I mean, we can always do better.
Carla?
Thank you, Chair. I'm wondering about kind of workplace culture and the roles that can play in some of the stories that we've heard from survivors who didn't feel that they were necessarily treated respectfully or fairly and resulted in feelings of shame and worthlessness. I'm wondering if, there's been some improvements that you mentioned in terms of how we go about handling and working with survivors. I'm wondering if you've noticed a shift as well in kind of the workplace culture when it comes, and I'm kind of guessing, I don't really know what the culture is like or what it was like, but do you notice a change in the culture when it comes to sexual violence? Is there more talk? Is there more training? Is there more, do you receive more supports, I guess, and in general, the workplace culture towards sexual violence, do you find that's changed?
I started back in 1998, and I find it's changed, exponentially. If a sexual assault came in, it was kind of like, don't pick me. Now it's, a lot of the officers are trained, and a lot of them are very good with victims. A lot of the times the victims want to talk to females, and we do have females on staff made available to them. The culture has definitely changed. There is more talk, open talk, amongst the men and women in the department. You know, they know if they have questions, they can come and ask us. You know.
Okay, perfect. Michelle?
Thank you, Chair. Thanks again for being here. I'm going to rewind quite a bit, right back to the very beginning. And you had made a statement that 93% of the reported druggings came from one person. Can you tell me how many reports of druggings you've had?
So, just want to make sure my mic is on.
Oh, Tara? Yes.
My understanding, and this would be fairly accurate, in this year, 2021, I believe there was 45 reports of administering a noxious substance. 42 of those would have been reported by the same individual. And they would have been unfounded.
Michelle?
And so that's just in this 1 year. So the 93% of that one individual was just in this year, not representative of historical prior to 2021. Okay. Do you have a stat on how many druggings have been reported in total to Charlottetown Police Services?
I do not.
Tara?
Okay.
I don't have the total number, but we could get it for you if you'd like.
I appreciate that.
Michelle?
Thanks, Chair. So the reason why I ask, I'm interested in why if you've had 45 in 1 year, so we know that there's been others that we've had several people coming forward talking about it, and I'm interested in knowing why in September you went public with those 2 cases and shared that with the public. And was that the first time ever that you have shared publicly that there was druggings in Charlottetown?
No. Back in 2007, anytime we hear of drug spiking, we try to make the bars aware of it as well as the public. And I know back in 2007, when the individual was charged, we didn't have social media the way it is now to get the word out. It usually went on through radio or TV, just say, we want to make the public aware that we've had a couple of drink spiking incidents, to please, be careful, use the buddy system, watch your drinks. That was the way to get the word out. Now that we have social media, it's easier for us to put it out on our website or through Twitter. I guess it's the ease of letting the public know of what's going on. It's much easier now than it was back then.
Michelle?
Thanks, Chair. So prior to September, when was the last time that you had issued a public safety release?
I
On
want to
this
say it'd be
topic.
around 2007, probably.
And Tara?
So I just want to be clear, because I believe Sydney mentioned it earlier, when you had asked a question and you had mentioned that there were a number of incidents reported to police this summer. But I just want to make it very clear that, and this is with respect to a media release, there was a request to meet, an individual had requested to meet with Charlottetown Police Services to discuss options for reporting incidents, not necessarily drink spiking, but sexual assaults. So there was a meeting arranged in, I believe it was June, and that was with myself. And I had met with 3 individuals, and they had provided documentation of a number of incidents that were alleged to have happened, many of which were anonymous. And it was very clearly explained to those people who were none of which were directly involved in any offense that had taken place or was alleged to have taken place. It was made very clear that what that process would be to start a formal investigation on any one of those specific incidents, and the importance of understanding that every incident has to be investigated separately. Like, every case is unique and must be investigated separately. And the starting point to that would be the person directly involved coming in to file a police report. So I just wasn't sure if you believed that there was 17 reports made this summer. Okay.
Michelle?
Thanks, Chair. So I don't think I'm clear. So when you say 40, 43, I think you said, or 45 in so far this year, does that include all of those that were reported by that one individual, or are you talking about other incidents other than the one that went to the media where she had stories from several people, which you just were referring to? Is that the 93%, or are you talking about somebody
Okay.
else who's the 93%? I'm just a little confused as to
Yeah,
where
so
we're at.
we've had 3 since, I believe, October. There was 2 in October that came forward, and they're still open investigations. And the rest are all from the same person.
Tara?
So just to be clear, that when those individuals came to the office to discuss options, and they were explained what that process would look like if someone wanted to report a crime to police, that doesn't initiate an investigation. That meeting that day did not initiate an investigation. That was providing information to individuals on how someone would go about reporting a crime to police if they were wanting to do so.
Michelle?
Thanks, Chair. So that individual aside, there were 45 drug spiking complaints this year in 2021, and of those, they were 93% were from one person, and you found those were all unfounded. Is that accurate?
Correct. And that's
Okay.
not necessarily drink spiking. That could come in any form. So if someone, let's say, were to be hallucinating and thought that there was chemicals being pumped through their vets, that could be reported, and that is what that would fall under, is administering a noxious substance.
Okay.
It's not necessarily drink spiking.
Michelle?
Thanks, Chair. So can you tell me how many reports of drink spiking you've had in 2021?
3.
3. Okay.
Michelle?
Okay, thank you, Chair. I feel like that took a long time just to get to there. So I want to go to the unfounded numbers and a comment that you had made where in 2018 you don't feel like they were accurately reflected. So in 2018, you say that there was a change that was made. So you feel like the numbers are different. Do you have actual data to support the way that you feel about those cases, those numbers, to support saying that you feel like they were not correct? Do you have actual data to support that?
We would have data, but not with us right now.
Okay.
Michelle?
Thanks, Chair. Because in that report that came out that was talking about the unfounded cases, it showed that in 2019 we were twice the national average. In 2020 we were also twice the national average. So given those, do you dispute or feel like those numbers are not accurate?
Tara? Jen?
We don't dispute that that's an inaccurate statement, but there is definitely a difference from prior to 2018 to when those changes came into effect.
Last one for now, Michelle?
Yes.
Yes.
Thank you. So we heard from PEI Rape and Sexual Assault Center that they do not have capacity to accompany someone who has had, a sexual assault or experiencing something like that, meaning they can't go to the police station with them, they can't go to the hospital with them. Does the Charlottetown Police Services have counselors on staff that can actually take that act to basically be there to support a victim?
If it falls within working hours, we can contact a victim service worker, and they would attend if necessary, but we do not have a counselor on staff.
Okay, thank you. Thanks, Chair.
Thank you. Rob?
Thanks, Chair. And I guess first I wanted to acknowledge His Worship Mayor Philip Brown here in the gallery and watching the proceedings here. Thanks. I guess the other, from my perspective, I want to kind of follow up a little bit on Michelle's. So we're really down to 3 cases, although 45 instances. Most of them were pertaining to one individual. How does that compare to other jurisdictions? So I'll say other cities in Atlantic Canada, as an example, Halifax, Moncton, St. John. I mean, I'm assuming as police forces, you'd sort of have some consultation between other jurisdictions to see, is this an epidemic here in PEI? And I'm trying to get my head around, is it or is it not? I mean, I get one case is serious, but how do we compare to other jurisdictions?
I don't know what the stats are for Halifax or New Brunswick. We don't have access to their computer systems to find out what their stats are. I mean, on population.
Rob?
Well, I guess I would assume that there would be at least some consultation to see if you know, I'll just say whatever city, like that the police services on Charlottetown would contact others, or you run into these types of situations and sort of have some sort of a feedback on that. So that's why I guess I'm just trying to compare that. So you don't do that, or?
If we feel that something is you know, if the drink spiking were at such a rate that, you know, I mean, even one is a concern, but
Yeah, I know.
you know, with the 2, we may send off an intelligence bulletin to Nova Scotia, New Brunswick, which we do through CIS-PEI, with things like that. That yes, this is what we're finding, you know, depending on which drug is being used. If we knew like there was a spike in rohypnol or GHB or the benzodiazepines, we could send out a bulletin to other police agencies to see, you know, if they're having the same problems that we are or not.
Rob?
Well, yeah, I guess where I want to lead to this is that Charlottetown and Prince Edward Island, we're a pretty significant tourism mecca or capital in the Maritimes. Is there any kind of a sense that that this is a bit more tourism? Do you see I'll say a spike in drink spiking in the summertime? Are some of the perpetrators or possible people or suspects that are doing this, are they tourists that are coming here and doing this, or are they islanders that are involved? And that's where I'm kind of getting back, if it's somebody from Moncton coming over here for a weekend and they're doing a little bit of that, and then they're going back to Moncton and doing the same thing there. Because you did mention that 93% of some of these cases in the past have been perpetrated by one individual. And, or am I misunderstanding that? But, you know, to sort of say how illicit is this in other jurisdictions, and how does that impact Charlottetown?
So just to
Tara?
Just to clarify, when you talk about those 93% were, I forget the word that you used, but perpetrated by one person, we're not saying that there was an offense there.
Right.
That was unfounded. That is falls more under mental health. Okay? That would be where the person reported that is the complainant. There was no offense perpetrated in those cases. And as far as if we're seeing this in relation to tourism, I believe Deputy McCarron had indicated that at least 2 of those 3 alleged drink spiking incidents were reported since October. So it wouldn't fall in our peak tourism season. And yeah, so we don't believe that they were linked to anything within other Atlantic provinces or anything like that.
Rob?
It's fine, I thought there might have been, but if there's not, if it has nothing to do with any fact that we do have a lot more people here drinking and having fun in the summertime than other parts of the year, I just thought it might have been.
Yeah, thank you. Sydney?
Thank you, Chair. You had mentioned that there was one charge laid, and I thought in media reports they had said there was no charges in 20 years. Can you just clarify around the drink spiking?
So that case that I spoke of was in 2007. And I believe the Crown may have a better reflection of across the island, any statistics as far as convictions for that specific offense, but yeah, that was the one, and I believe there was a number of charges that were laid in relation to that individual.
Thank you.
Sydney?
Carla, you had talked about the workplace culture, and you both had mentioned about more open talk, the trauma-informed training. Is that mandatory now within Charlottetown Police Services, that training?
It's not mandatory right now, but I think as part of the Canadian Association of Chiefs of Police strategy towards sexual violence response, I think that may be something that we will see, that it will be mandatory.
Sydney?
Thanks, Chair. It could be something that you would just opt into, automatically on your own too, right? Like it'd be.
It could
I
be.
find it surprising that I know you have it obviously in your role kind of thing, but why everybody wouldn't opt in and take that.
I think you will see that this will become part of our, like as police across the island, there's certain training that's mandatory every year. And I think you may see in the future that this will be part of that.
Sydney?
You had, I guess since the reporting, and I appreciate the clarification earlier about what had happened in the summertime about the meeting versus 17 cases, so to speak. Since that, since the media reporting that has happened on this, we have seen, it's been reported that more people have come forward with stories, not to police, but have come forward to a various number of, say, media outlets or whoever. People not coming forward to police is a real issue. A trust is an issue, right? And I can only assume that's very concerning for you. When things like the third option are out there, that is another avenue for someone to go and have the test done, but not go to police if there's a trust issue there. Is that working in your situation? Are you getting files from the third option that when people can go to the hospital and get a test done?
We don't hear. See, if someone chooses a third option, everything is anonymous, and the sexual assault kits are kept by the RCMP, and they're anonymous until they decide to come forward. That's when we would, depending on jurisdiction, if it fell within Charlottetown, that we would take over that file.
Sydney?
Thank you. I guess that's my question. So, like, if it's within your jurisdiction, that will come to you if someone wants to go that route.
Yes.
So, my question is, has that happened? I know it's confidential and you don't see it until that time, but my question is, has it ever come from the third option here since we started in PEI?
Not yet, no.
I will say I did have a case where someone attended the hospital and indicated they wanted the third option, but then a very short time after leaving the hospital decided to come in to the police department to report that, and so it didn't end up going through. It ended up being reported to our office very quickly after that collection of that evidence. So
Sydney?
Thank you, Chair. I think that's an important piece of information to know, like, if we've got other options, if trust is an issue, if they're being accessed and if they're being used. So, I know we don't know how many of them are happening that you just never see kind of thing, but if there's never been one, and, I think it's, rape and sexual assault is too common. I'm curious, I feel that's a good piece of information for us to know, that either to make sure that more people are either aware of the third option, or whatever that disconnect is from it being done and then reporting to police. So it's more just, I'm good right now. Thank you, Chair.
Thank you, Sydney. Lynn?
Thank you, Chair. So I'll come back to a couple, actually, I'm going to start somewhere else, and then I will come back to the point that Michelle was making. I am hearing from a number of people, not just with Charlottetown, but from a number of people who have decided reluctantly to come forward to police and express their concern that a sexual assault had taken place, or that drink spiking, had taken place, and they felt they were being discouraged from trying to press charges or from pursuing that. And I believe when the PEI Rape and Sexual Assault Center was here, they reiterated a similar theme. And I'm just wondering if you can comment on why people would be discouraged from moving forward with filing a complaint.
It's unfortunate that people would feel that they were being discouraged from having that investigated. If the evidence is there, then that investigation can proceed. Like when you say, I think you said didn't want to press charges. In order to press charges, you have to have evidence. And so, when we talk about drink spiking cases specifically, that collection of evidence is so important to prosecuting those cases. And we spoke about how quickly that evidence can be lost. And so, the only thing I can think of is that someone may be discouraged is because of the passage of time, that evidence was no longer there to support that investigation. But I'm not really sure.
Lynn?
Thank you, Chair. So I'm going to go down that path a little bit. I've heard from a number of people who work in the medical profession that they routinely see cases of drugs in people's systems, but that is not automatically reported to the police. Is that correct?
That's correct.
Do you have any, thank you, Chair. Do you have any sense of why that, is this a legislative gap that they are not obligated to give you that information? It seems like a public safety concern, whether or not I as an individual wanted to press charges. If I report that I've been drugged and we find evidence of it, and Carla does, and so does Michelle, there's now a public safety concern, regardless of whether or not one of us wants to press charges. But if that information doesn't get to you, you believe there's only been 3 druggings, which would not reflect the information that we have in healthcare. So I see a gap. And I'm just curious if you have thoughts on whether or not mandatory reporting, even if it's anonymous information, but with basic information around where the incidents are occurring even, if that would be useful for the police services.
It would be very useful, even if they didn't want to press charges. And when you go to the hospital and say, you may say, nurse, I feel I was drugged, they're not obligated to call us without your permission. So there's a huge gap there with reporting. They may see 20 cases and one may come to us and we don't know about the others. Yeah, that is a huge gap.
Tara?
I just would like to hear more about that, the medical, are these individuals that are attending the hospital and specifically reporting that they think they were drugged? Okay.
Yeah, so
Lynn?
Thank you,
Yeah.
Chair, if I may. I've heard this now from 2 different sort of streams. I've heard from people who work in the medical profession that they routinely see people presenting at the ER, believing they have been drugged, being tested, and being positive for noxious substances, and that information is not automatically given to the police, is what I was informed of, which came as a big surprise to me, because that seems like a huge gap. But then also, I've heard from individuals who have presented at the hospital feeling more comfortable going there than to the police station in the beginning. And they've had sort of two outcomes. We have one set of people who tell us about having been drugged and finding those drugs present in their system, and then also sort of the bias that other people experience when they show up at the hospital, and they say that they believe they have been drugged, and the sort of response is, oh, you're just drunk, and they don't actually get tested, and how critical, as you were saying, it is to collect that evidence in a time-sensitive way. The fact that there is no mandatory automatic testing when someone reports saying they believe that, and then also that that information doesn't get to you. I like looking at this as a system, and I just feel like that's a huge system gap of information you're not getting access to.
Tara?
So perhaps Health PEI could better answer that.
Yeah, I was just
Lynn?
curious if that would be useful information to you. It sounds like, yes,
Yes.
it would be useful information to you. And then the other part of that I wanted to unpack a little bit is how we investigate multiple assaults that could be linked. I think we recognize that sexual predators very rarely are one-off sexual predators. I think we understand that the pattern of sexual assault is generally escalating, and that if someone gets away with something, they are likely repeat offenders. I'm very interested in knowing that potentially 17 people reported that their drinks were spiked, and there doesn't seem to be an overarching investigation that is saying, okay, a lot of these people were in similar venues. I might not have enough evidence to pursue a case for Lynn or for Carla or for Michelle, but my goodness, their stories are very similar, and they were in similar locations. They were around similar people. Is there an overarching investigation that can be done on the system, on the three cases together, that would perhaps produce more evidence than an individual investigation could? Does that happen? Do you know what I mean?
Yeah, so when you talk about 17 incidents, again, like, someone would have to report their specific details to an investigator so that that could be investigated. And with respect to the three cases that were reported in 2021, I don't believe there's any reason to believe that those cases are linked. But certainly that would be something that, the investigator could determine if it was all happening at a specific location or within a specific time frame, or whatever the circumstances are, then that linkage could be made.
Lynn?
Thank you, Chair. So 2 points off that. Has that ever happened? Have we ever investigated a multitude of either sex crimes or drink spiking reports as a collective? Have we ever investigated that as a unit?
The one from 2007.
Was multiple.
Yeah.
And
What?
the other question that I had on that is, why is it that I myself would have to file a complaint if there is multiple stories coming forward? Like, if I said my neighbor's car has been broken into, does my neighbor need to call and confirm that his car has been broken into? Or if I say, oh, 3 cars on my street are being broken into, can you look into that?
We go to each individual one.
And if they don't wish to report,
We
Then
don't
we-
hear about it then.
but if I, as the neighbor,
If you had said, yes, my neighbor's car was broken into, we'd go see him.
and if he, for whatever reason, does not wish to give an interview, is that just the end of it?
If a person, sorry,
No, it's I lost
my
control
fault
as the
too.
chair
I'm
for a
sorry.
second there. So, Tara, I'll get it back here.
I'm not catching on here.
My fault.
So, okay, now I'm off track. If someone, so if a neighbor calls and says, my neighbor, his window was smashed, and that neighbor does not want any further police action, then that would be the case, like,
Even if there were multiple cases
Lynn?
on, thank you, Chair.
You're welcome.
Even if there were multiple cases on the same street, we wouldn't be trying to find the commonality.
we certainly would as investigators, but if that person did not want to be part of an overall investigation, then that's their right. If they don't want to be involved and included in that, they wouldn't have to be.
Lynn?
Thank you, Chair. So I guess that is counter to a question I had asked earlier on whether or not that sort of anonymized information would be useful coming from healthcare. If I am a healthcare worker and I see 6 cases coming in tonight that all are at the same location and I can see that people were roofied, if I provide you with that information, it would not be useful unless those 6 people want to press charges. You would
Unless
not look
they
at the
came forward, yes.
Jennifer?
Sorry.
Yeah, no. Unless
Yes, they have to come forward to us and make the complaint. Because each investigation's unique, what happened to you may not have happened to Carla, so we need both to get information from both. Yes, if they can be tied together and we can link that, okay, this belongs to one guy, then we'll focus on that person, or male or female. But they do have to come in individually to give their statements.
Last one.
Okay, thank you, Chair, and then I'll go back on your list. So I'm really interested in this from a public safety perspective. I find that very curious because even if I myself am not ready to press charges, but you know there were 6 cases at a similar location, at a similar restaurant or bar, I wonder about the public safety component of that. If you have that information and we're not looking into it to try to find out if there is a common perpetrator, even if I myself am not ready to report, I worry about the staff who work at that restaurant who then see someone and believe that they have had too much to drink and now put them outside and they're drugged and they are now at greater risk. It seems like that absence of overarching public safety investigation, even if you don't have an individual ready to seek justice alone yet, it does seem like there's a gap in safety. I'm curious what your thoughts are on that.
Okay.
Tara?
So we're talking if that were the case, where the QEH or whatever medical facility were able to provide that information to police. So if we come to a point in time where that is something that can be shared with police, and the case that you specifically said, if say staff at the QEH one weekend had 6 cases of someone being roofied, yeah, that would be a public safety issue. And we would want to, at the very least, do our due diligence to make sure that we, and again, like right now, we wouldn't be able to get that person's information, right? If they didn't want to. But if that were the case, then yes, we would reach out to see if, if there was a linkage there. And like you said, if it's one location, a specific establishment within an area, then, but that information has to come to police through the appropriate manner. So if, like you said, if that were the case where QEH could call us, then, and provide us with that information.
As lawmakers, that's certainly something we could mandate. So I'm just trying to get a sense of whether or not that would be a useful exercise and whether it would result in additional investigations. I'm all over the place, Gord. Sorry, Chair.
That's okay. That's okay. Yeah, quick answer.
Yes, so, like Tara said, if the QEH had that and could give us that information, we could set up plainclothes officers in that establishment, proactive, get ahead of it. After the fact, it's kind of like, the information is good, be proactive. It's when it comes, like I said, from 2010 to 2011, all our evidence is gone. Your DNA, your video surveillance, with the passing of 10 years, memory. That's what makes that going back difficult. But if we can prevent it, or we hear stories like this, then yes, by all means, we'd be proactive.
Zach?
Thank you, Chair. Thank you both for coming in. And My line of questioning isn't along the same lines as Lynn's, but somewhat is what you talked about there a little bit before, Jennifer, was the prevention side of it. What did you mention? You gave the stats of the two most common drugs that were found in drink spikings.
Well, there's rohypnol, which is called roofies.
Yeah.
There's GHB, and we also have benzodiazepines.
Okay. So has there ever been a conversation with either the RCMP drug units or like the cities, like the city officers to maybe try to further enforce keeping these drugs off the island? Do you know what I'm kind of getting at?
Yeah, I do. That's near impossible because your benzodiazepines, they come in the form of Ativan, Valium, the stuff people need. If they have anxiety disorder, seizure disorder, these are prescribed to them. And these are the types of drugs that are being used. With rohypnol is a very strong benzodiazepine, which can cause memory loss, inability to move. We see a lot of the Xanax on the streets being sold. To get rid of the drug trade altogether, it's never going to happen because the supply and demand is there.
Okay.
And that's what our street crime officers do, and it shows us a trend of what's being used on the street. What is the popular drug? And it does help us say in some of these investigations if we hear, okay, or we have a seizure that has an abundance of MDMA or Xanax bars, and stuff like that, that we know it's out there.
Okay.
Zach?
Thank you, Chair. So on that, I guess how, when you talked about earlier with the public awareness campaign, again, it seems like the public awareness campaign, it almost has to be reactive and it can't be proactive. Is there any ways that, Robbie had talked about jurisdictionally, if you're speaking with other departments, is there any way proactively that you can get out ahead of, as opposed to saying, there's been drink spikings at this bar, watch your drinks?
I think the only way to get ahead of it is the constant education, not just when something happens. Proactively, we can have information on our websites, what to do if this happens or what to do if that happens. Unfortunately, we do have a lot of reactive policing, and proactive is more community-based. And the drugs, a lot of people don't like to talk about it, so it's, everyone knows it's there. To put a campaign out on it, I don't know, drug-wise. If we have the information, yes, like if we're seeing a spike in roofies, have that out there so people know it is. But we're kind of behind the eight ball, sort of, because we kind of find out after the fact.
Yeah, no, I'm good. I'm good. Thank you, Chair.
Okay. Carla?
Thank you, Chair. I'm interested in going back to something that you had mentioned earlier and kind of some of the things that we've touched on. When you had mentioned earlier that you speak to bar owners. So I'm wondering what sparks that? What sparks you going to a bar and saying, so like, kind of what's the process to say, okay, it's time to have a conversation with this bar, or these bars, all the bars. What sparks that?
The information that there was someone putting roofies in people's drinks at the certain bars.
Carol?
Thank you, Chair. And that would, so one complaint would be enough to kind of spark that to get that in gear?
Yeah, it would, you could pick up the phone and call the owner of a bar and say, we received a complaint that somebody was drugged at your establishment, to make you aware of it, to watch for it.
Carla?
Thank you, Chair. And so is that kind of the extent of the conversation with the bar, just to kind of keep an eye out for it?
Watch your patrons, watch your, staff, keep an eye on people that seem overly intoxicated and they haven't had a whole lot to drink. Anybody who's hanging, things to look for. Someone who's hanging around the bar or buying excessive drinks for females that are there should raise red flags. And I don't know if it's taught with the responsible server or not. I don't know if they touch on that, but that's something that might be worked into their curriculum for that.
Carla?
Thank you, Chair. That's a really good point. The responsible beverage course would be a perfect spot to have those conversations, to be proactive in this. And the reason that I asked kind of what the conversation was is because, we don't want our establishments kind of inadvertently helping people be assaulted,
Exactly.
like putting
Yeah.
someone out because they're too drunk, and so I wonder in those conversations, I think that there's an avenue we need to go down further and to say, what do you do when you do put someone out who might be too intoxicated? Should it be something you automatically, I think that there's a gap as well. And I guess my next question is related to the campaign. So I can remember in the bathrooms at Hunter's, there used to be the campaigns about watch your drinks. Who comes up with those campaigns?
I'm not sure who comes up with them. I know we're trying to change that now. We did have a meeting on that, I think it was last week, with all the police departments and the Liquor Control Commission and the Rape and Sexual Assault Center, UPEI, to come up with something better than girls watch your drinks.
Exactly.
Don't spike drinks. Spike drinks.
It'd be great. Your buddy system,
Yeah.
take the onus off of, people shouldn't have to watch their drinks when they go out to have a good time, period.
Exactly.
But unfortunately, we do. And we do have to make people aware that you have to be responsible, number one, to yourself, but if you're with friends, and if your friends are acting strange, that it's not normal, then you need to speak up.
Carla?
Thank you, Chair, and I'm so happy to hear that those conversations are being had with the PEI Rape and Sexual Assault Center, because they will definitely say telling women to watch their drinks is not the way that we tackle this. So I'm really happy to hear that. My last question for now, I think, I'm wondering, so when someone comes forward, when a formal complaint is being brought forward, and before evidence is collected, is there something that prevents, it just seems like there's something missing, and we may have already talked about this and I may have missed it, but there seems to be a bit of a gap in terms of us being able to be proactive. And so, I'm curious if there's any, this might be something that is a bit wonky, but is there any sort of policy or law that kind of gets in your way of being able to be proactive in terms of kind of what we had just talked about Health PEI reporting those numbers to you? Is there anything that kind of you see as a barrier to being more proactive about things like drugging and sexual assaults?
Unfortunately, right now, with respect to these, we are reactive, and if someone is reporting it, then we're doing what we can to make sure that there's a thorough and complete investigation. And at this point, I don't know if there's a barrier.
I guess if they're reporting at the hospital and it's not getting through to us, that is a public safety issue. And yes, through privacy laws, we can't release certain information, or they can't release it to us, and that would be a huge barrier. Not because, and it might be something as simple as just calling us and say, I've had 6 people in this week that said they had been drugged. That information would be invaluable to us.
Yeah. Thank you, Chair.
Michelle, and then Lynn, and then we're kind of moving towards the end here, so thanks for your patience, guys.
Okay, so I've got some questions we've talked about the drugs. I'm going to talk about GHB and Rohypnol. So often whenever you have drug busts, you would publicize what you found and how much of it, etc. Have you had drug busts that included GHB and Rohypnol?
Not in the liquid form, like that might be slipped into a drink. Not that I'm not just saying it hasn't, but I haven't seen any yet. Benzodiazepines, 100%. And I know Rohypnol can come in different forms, like liquid or a small pill that dissolves quickly, but we haven't had the seizures of Rohypnol. And I don't know about GHB, I could be wrong, but I don't think we have.
Okay.
Michelle?
Thank you, Chair. So I'm going to go down kind of another path. So does Charlottetown Police Services use informants?
Yes.
Okay,
Michelle?
thank you. So if someone who is an informant for the police and there's allegations that are made against them, what's your protocol?
Allegations made against a source,
Yeah.
they'd be charged, like they have to abide by the law. They can't break the law if they're a source. They still have to abide by the same rules and regulations as everyone else.
Michelle?
Okay. Have you ever had an instance where an informant, somebody has made allegations against an informant that there's been wrongdoing or that they've been involved in anything?
Not that I'm aware of, because confidential sources are confidential. If a complaint is made against someone of the public, they would be treated the exact same. If charges could be laid, they would be laid. I don't think we've ever had a complaint against an informant with regards to putting drugs in a drink.
Michelle?
Or selling those types of drugs that would be used for that, like GHB or
No.
Okay.
Michelle?
I'm going to jump to statute of limitations. With sexual assault, there is no limitation
Correct.
on statute of limitations. So how long do you maintain evidence?
If someone is charged, it has to be kept in custody until any appeals or anything. I know we have sexual assault kits that could go back. I know some of that's gone back 10 years that are still at our office, but I don't know 100% sure how long they keep the evidence. I don't see it being destroyed if it's an unsolved sexual assault. It wouldn't be.
Michelle?
Okay, that's interesting. So if somebody has lodged a complaint, and you have all their evidence, and that has not been resolved, their sexual assault has not been resolved, you would still have all of their evidence available to
The
them?
sexual assault kit would be there. I do believe that's how it is.
Tara?
I think it would depend on when that kit was obtained and how it was cleared, because sexual assault kits need to be stored in a freezer, and I believe after a certain time they are destroyed, depending on how that file was cleared. But I don't want to say specifically because I'm not 100% sure. It's our forensic identification officer who handles all those exhibits, the sexual assault kits, and maintains those. So I don't want to speak because I'm not certain the date on how long those are kept if they are not cleared.
I just to follow up on that. But if there is no limit to the statute of limitations on a sex crime, how are we not sure how we're maintaining the evidence to ensure that, like my colleague has said, if there is some way to link something together, that should be able to happen after 10 years because there's no statute of limitations on sex crimes. So what is that evidence process? Isn't that something that should be very well known throughout the police services?
Yeah, I should know the answer to that, but I don't. And I could check with our forensic guidance officer, because all that information, like when the sexual assault comes back from the hospital, it goes into a locked locker, which he unlocks, takes the kid out and puts in a freezer. Yeah, I could find that answer out for you easily enough from him as to how long they keep them.
Okay, my only comment, not a question, hopefully
Yes.
forever,
Yeah.
because there's or until it's solved, because there's no statute of limitations. And you would be taking away a person's right if you destroy evidence on an unsolved sex crime.
Correct.
Okay, thank you. Thank you, Chair.
Thank you. Lynn?
Thank you, Chair. So I have a few questions that head in a bunch of different directions, so forgive me if these feel a bit disconnected. A lot of questions that I have came in from survivors who were also curious about specific things, but I do want to go back to the example we were using of if the car was broken into. And I let you know my neighbor's car was broken into. I believe you had indicated what you would do is go and speak to my neighbors. And I'm curious, in the instance of the multiple cases that came forward this summer, did you go and speak to those people to see if they wanted to?
No.
Is there a reason?
We don't solicit victims. You want the person to feel comfortable enough to come in to be able to tell their story. And if they're not, like, I almost feel like you're overstepping your boundaries to try to get them to come in. If they want to tell their story, we're here to listen. But police aren't to go out and search for victims.
Great. Lynn?
Thank you, Chair. I was of the impression, and I stand to be corrected on this, that some of the some of the cases in those 17 files that had come forward had included contact names of people who did indeed want to be reached out to. Am I mistaken on that?
I'll give you that one.
So some written documents did have a name attached, and it was made very clear to the individuals that were requesting a meeting to discuss options. It was made very clear that if any of those individuals, whether the anonymous or named, were willing to and wanted to speak to police, how that process could be started.
Lynn?
Thank you, Chair. And for our knowledge, could you give me a sense of how that process would be started? Is it just to reach out?
Yeah, so I would have specifically provided my contact information to those 3 individuals and explained to them that if they wanted to report a crime, they would contact Charlottetown Police. It would could be myself investigating, but that's not necessarily the case. But it was made very clear that because there was a meeting, that was not initiating an investigation.
Lynn?
Thank you, Chair. So if any of those individuals did indeed wish to initiate an investigation now, that would still be possible? They would just have to reach out and that could start?
Correct.
Lynn?
Thank you, Chair. I've also heard from a number of people who were interested in accessing their file after having made a complaint of either sexual assault or drugging, and they have found the process of accessing their own file onerous and in some cases almost impossible. And I'm curious if you can speak to that, because it seems if there was a complaint made against me and I wanted to see the file on that, I could do so.
We don't give out the file. They can make, and I did speak to and made arrangements for someone to come in and see their file. They can come in and look at it. We can explain the investigative procedure. They can read what the officer's notes were. They're just not allowed to take it from the police station.
Lynn?
Thank you, Chair. So I have heard from different individuals who very much wanted to see their file. So all they have to do is set up an appointment and come in and they would be able to do that.
And I know what you're referring to, because I did speak to one of those individuals and they did set up an appointment for them to come in. And another one was reached out by the actual investigating officer who sent the email to say, if you want to see it, come on in. So yes, they can call in and ask to see their files. It's just not, I think it was a misunderstanding of, I want my file. It's like, well, I can't give you a police file to take, but you can come in and, yeah, we can review it with you.
Lynn?
Thank you, Chair. I'm curious if there have ever been any complaints within the department of how a case was investigated or how a complaint was handled of sexual assault or druggings. You probably,
Yeah.
yeah,
Lynn?
I'm aware that you may not know that. It would go to the police chief, and then that would, of course, be given to an investigator. There's a process.
Quality assurance
Exactly.
officer, yes.
So those were some of the questions I was hoping to ask the police
Yeah.
chief, and it didn't occur to me that I wouldn't have that opportunity, but you're probably not aware of whether or not any investigations have taken place or any complaints have been lodged.
Usually that's taken care of, so yeah, another matter.
I assumed as much.
Lynn?
Thank you, Chair. I have also heard from people who have felt that it was easier, no, I'm not phrasing that well. I have heard from people who have complained of being sexually assaulted and have gone to social media to talk about that experience after having a dissatisfying experience with a police force, not necessarily Charlottetown. And those people have said they found it was easier for their assailant to have them investigated for talking about their complaint than it was to have a thorough investigation of the complaint. They felt very strongly that talking about their complaint, about their harassment, about their assault, was investigated very thoroughly, but their actual lived experience was not. I wonder what your thoughts are on that.
Well, without the specifics of the case, and obviously we couldn't discuss specific cases here anyway, but yeah, it's unfortunate that someone experienced that. But without having the specifics of these incidents, then it's hard to speak about it.
One more, and then I
Lynn?
will let you bump me. Thank you. I am aware that we do not have a pre-charge screening requirement on PEI. I know that there is generally a consultation with the Crown before charges go ahead, but it's not an obligation. If ultimately police decide to press charges in a sexual assault case, they can, even if the Crown doesn't believe there's enough evidence. And I was just curious, before cases are dropped because the Crown doesn't recommend them, do we have a consultation with victims and survivors to see if they would like to proceed anyway?
That's definitely done in this case.
So definitely there would be, I think you said there's not an obligation to do a pre-charge on PEI, but there is.
The Act says that there is an obligation for a consultation, but ultimately, when it comes to laying charges with sexual assault, police are the ones who decide whether or not to proceed. That's what the Act.
So if we feel the evidence is there,
Yeah, exactly.
they can be arrested. And like Tara had said at first, we do up a complete file and we meet with the Crown to see if there's enough evidence to proceed in court. If the Crown feels that they're not, but the victim is adamant, they want to go ahead, I've seen cases go ahead in court as the victim wishes.
Sydney?
Thank you, Chair. I just wanted to follow up on the request for the police file. Our office had called today and they said it had to be a request to the chief of police. That's different than walking in and reviewing a file with someone. Like, can you explain to me what, if I showed up today, do I have to write a written letter to the chief of police, or can I just say, can I make an appointment to, like, what is the
I think there's
proper
a
thing?
bit of a disconnect there. Normally, when people want to review the files, and it's usually insurance companies due to accidents, they have to put what they want in writing and they pay a fee to get the accident report. If a victim wants to see the report, they should be able to call the investigating officer, sit down with the officer or someone who was there that day and review their file.
Sydney?
Thank you. So you say they should be, but like, is that the proper, like, is that proper, or is that local to Charlottetown Police Services, or like?
I think,
Because when we called today and they said a request to the chief of police in order to access your file. And I wasn't sure what that meant, if it was like, is that a delay of things, like to say if I go in and say, because what you just said makes a lot of sense, ask and you can review kind of thing.
Mm-hmm.
But then if you're also told at that meeting, oh yeah, you didn't put it in writing to the chief of police, like does it get bogged down in bureaucracy, or?
no, usually it's just, if they do put it in writing to the chief, he will set up the same meeting.
Okay.
Now, I think the policy kind of is more for the insurance companies, or if someone's looking for disclosure, where you have to have an officer present with you at all times. The request is put in writing.
Sydney?
Thank you, Chair. I mean, it honestly feels a lot easier to do that than, for if you're going through RCMP, where I think you have to do an ATIP, or access to information privacy request, a formal process to go through. So it sounds like it would be much easier with Charlottetown Police Services to get access to your file.
If you want, yeah, like I said, you can't take it out of the building, but we can sit down and go over it with you.
Sydney?
And just my last question, can you make paper copy of your file?
Privacy reasons, it stays at the police station.
Okay. Thank you, Chief.
Thank you. So we're with a couple, can you,
Can I do
one question?
Thank you, Chair. I am curious if a person can consent to sex when they have roofies in their system.
No. I guess it's been, and that's an issue we have that kind of falls under the court, like what level of intoxication is too much? That's an issue we have,
I know.
We can charge someone with being intoxicated in public and have the court overturn it because they weren't that intoxicated.
Because the courts haven't made it.
So I think it's all in how the evidence is presented. If a victim is unconscious, absolutely not.
Thank you. I just want to thank the committee for asking such an incredible question.
Do we have more?
Is there more questions?
Oh, I would love to follow up off of that if we're still allowed to.
Yeah, sure.
Fantastic, thank you, Chair.
All right, the guests are okay?
Does the committee meeting end at 3:30?
Well, they're always booked for 2 hours, so, yeah.
We start at 1:30, so we've got lots of time.
Yeah. Thank you. Go ahead.
Thank you, Chair. I know there hasn't been a clear level of what is incapacitated, right? We have not seen the courts make a declaration on that, and I know that's a frustration for a number of police forces that I've spoken to in trying to get charges declared. So do we have a sense if someone presents at the hospital, has a drug test done, it comes back positive for roofies, but the defense is making the case, yes, we had sex, but it was consensual? Can those two statements coherently exist together? Because it feels to me they cannot.
You can still charge, most definitely. And then it comes down to the court appearance. As it's going to become a he said, she said. And those are always the most difficult. That's what I find.
I think that's why it's important that the earlier these types of investigations are initiated, the more potential evidence can be collected, the easier it may be to identify potential witnesses, gather perhaps helpful video surveillance footage. Like we talk about the importance of having that exam at the hospital and having that evidence to determine the levels. And so I think that's what's really important, is to stressing the importance of the quicker that any evidence can be collected, the better off a case can be made before the court.
Yeah. Thank you, Chair. Yeah, I understand that entirely. Now, there was recently a case that was talked about in the media, and I am well aware that you wouldn't get into specifics of any specific case, and I wouldn't expect you to, but where an individual apparently had a rape kit done. There was DNA evidence that was linked to an individual who was at her apartment. There were medical records that indicated there were roofies in her system at the time, and she has no memory of the incident. He claims it's consensual, but apparently charges were not pressed. I struggle to understand why these sorts of stories wouldn't have gone before the Crown, because it does seem like if this wasn't enough evidence, what hope does anyone have of having enough evidence? I wonder if you could comment on it as if it were an example.
Do you want me to take that one? Sure.
Jennifer?
Sometimes everything in the media is not exactly how the evidence presents.
Fair enough.
Lynn?
Fair enough. Does anyone else have a question? Because if you do, we could move around for a second. That would be fine. Yeah, you can go to somebody else.
Well, just want to see, do you need to take a break, or how much time do you, like, if we're at that stage where there might be a 2 or 3 minute break? I just want to make sure we're checking in, because we've been, yeah.
I'm okay.
Okay.
Perfect. Great. Lynn?
Thank you, Chair. So I do have one other topic for you, if I may. I was looking at examples of other jurisdictions and how they are trying to tackle this in creative ways, and I saw some interesting committees that had been formed that are essentially civilian oversight on unfounded sexual assault cases. And of course, it's not just random members of the community, but it would be people like those involved with victim services, those involved with PEI Rape and Sexual Assault Center, people like that who have some expertise in the area, possibly lawyers, who would take a look at all of the unfounded cases that had happened, perhaps within a jurisdiction or a province, over a 3-month window or a 6-month window, and just review how that had gone and make recommendations. And I'm really interested to know your thoughts on the merits or lack thereof of that sort of engagement from the community.
I think the engagement would be great.
Yeah.
Anytime there's oversight, I think the officers would welcome it, because there's also the advice that comes along with it. That's something we may not think of, that they said, oh, maybe you could look at this. I think it's helpful, very helpful.
Lynn?
Thank you, Chair. I do too. And the outcomes from these first examples that we're seeing in other, even Atlantic Canadian provinces that are trying some of this out, are finding their unfounded cases are going down. They're reviewing some of those old unfounded cases with new eyes, if you will. And I think that goes a long way in restoring the public's confidence that those cases will be handled well.
Yeah.
I can tell you, and I'm sure this comes as no surprise to you, but all kinds of people who are assaulted feel uncomfortable to report it because they think they are not a believable victim. And that's a real experience for people, to feel like, coming forward, I've got no hope of anyone taking me seriously in this, and that has nothing to do with their own fault, but it has everything to do with the rape culture we live in, where we have these victim myths that exist and are pervasive, and their friends might not have instantly believed them. So they think, how in the world will the police believe us? So having that kind of sober second thought, that oversight, can go a long way in rebuilding trust, and it's something I'm actively exploring. So I appreciate knowing that's something that you think is of value.
Definitely welcome.
That is wonderful.
We do have victim services, does go through all our assault or any type of
Okay.
victim crime. Yes.
But can you elaborate on that a little bit?
Now, I don't know how often they come to the police station, but victim services does come and go through our files where charges have been laid. So if someone's a victim of a crime, we notify victim services with their name and number so they can reach out. Sometimes people don't want to be contacted by them, and sometimes they do, but it's our duty to inform them of victim services.
Can I ask him?
Okay, sure.
Thank you, Chair.
Lynn?
That actually reminds me of another question that I had. I had a number of people ask me, when they come forward and make a complaint, even if there's not enough evidence to proceed, do we tell people about victim services?
Yes, we do.
Victim Services is an incredible organization. There's no question about that. The work that they do is,
It's mandatory for us.
didn't know
We've made
that.
it mandatory, yeah.
and is that just within your police department, or is that police departments writ large?
I don't know. I think across the island it is,
Is it?
I believe, yeah. If you've been a victim of a crime, it's mandatory that you, like there's even part of our computer system, you have to check off that Victim Services has been notified and who notified them.
Sorry, that is if someone has been charged.
Oh, I see. So if I make a complaint, but we are not ready to press charges, that would not be the same?
I believe they're still notified.
I know Victim Services.
It's offered.
Victim Services will work with people whether or not a charge is laid,
Mm-hmm.
but I wasn't aware that police always made that option known to people.
Yeah.
Jennifer? Yeah, Lynn, I lost control, so
I'm
I was just
sorry.
getting it back, so I just want to make sure.
I'm
I
tricky to
answered.
control, I recognize.
That's- Lynn?
Thank you. I believe you were going to comment on that.
No, I won't comment. I believed it was only if someone was charged, so that I may not be accurate.
Perhaps some clarity on that, if you wanted to even shoot us off an email on that once we get back to the office. I recognize we're asking on a wide range of questions, and you might not have the answers to all of them memorized. I understand that, but any additional information you could send along would be
Okay.
fantastic. And one
Lynn?
other, thank you, Chair.
Yeah.
Appreciate that. One other story that I had heard from an individual was a very historic case from a long time ago. But at the time, she was not prepared to press charges, but wanted to, or press charges is the wrong turn of phrase, and I'm aware of that, excuse me. She was not looking to pursue that, but wanted a record kept, and had asked at the time, is it possible, if any other complaints or allegations are made against this individual, for me to be notified so that we could try our cases together? There might be additional evidence if it were two cases. And I'm curious if is that a possibility? Is there a way of trying these cases and linking them together?
I believe that might be a better question for the Crown when you meet with them. I think, and again, I don't want to speak to it because I'm not certain, but I think it could become similar fact evidence in one case.
More fact evidence?
Yeah. But that might be a better question for the Crown.
You can go.
Michelle?
Great, thanks, Chair. I'm going to go back to the 2018 numbers and like around the unfounded numbers again, because I believe that those numbers were based out of Stats Canada is where they came from. It's a pretty reliable source there, I must say. So I'm going to ask about what you think you're seeing when it comes to sexual assaults and sex crimes over the last, let's say, 5 years or 10 years. Are you seeing an increasing trend, or are you seeing that it is stable, that it isn't fluctuating? What are you seeing?
So, and I guess when I talk about how I felt there was a difference from 2018, and I didn't prepare that, those stats, but I think that now that there's more options on how they're cleared, I feel that they are being spread out amongst those other options that we talked about. So insufficient evidence to proceed, victim complainant declines to proceed, no suspect identified, charges recommended, but all declined by Crown, or victim requests no further action and a suspect has been identified. Like spreading it out over those various options, we're definitely seeing more of those being used. I don't know if
Sure.
that answers.
Great, so more options to choose from, but what is the trajectory that you're seeing under those options? Are you seeing charges laid, charges recommended, but Crown refused? Is that one of the,
Declines to proceed to court.
yeah, so do you track the numbers on that year over year to see where those trend lines are going so that you can flag, you know, are we seeing an increase in sexual assaults? Or are we seeing an increase in the Crown declining to prosecute?
There is a way, I believe, with the system that we could do that and then have a comparison. I don't know if we could actually, I think it'd have to be done each individually, the way it's scored, like if charges were laid, we could gather that opposed to, say, the insufficient evidence to proceed or the victim declines to proceed or the Crown. Like you could do it. It'd be a long process, but it can be done.
Michelle?
A lot of process, but I see a lot of benefit in it.
Yes.
Because data really should inform everything that we do in order to substantiate action. And so if you are actually tracking and you're collecting that information, so that information should be used somehow. So am I hearing that that's not actually data that's consolidated, that's provided to any police that, you know, so they can actually see what's happening in different areas?
I mean, it's done. Our criminal analyst does all the numbers. I don't have the numbers for you. For me to get them, that's kind of the process I would have to go through, but I could get our analyst to bring them all up right across the board, and we'd know, you know, within minutes what the trends are. And he does do that on a daily basis, so we do know the trends, you know, of how many sexual assaults have gone to court, how many charges were laid, how much was insufficient evidence. Like, they do track that, yes.
Okay.
Sure.
Final question, Chair. Is that something that you can share?
Yeah, if I could get him to do a printout of it, and yeah, I can let you
Like-
know.
Chair? Like a year over year would be, you know?
The
going back-
breakdown.
Yeah, for
Yep.
like 5 years or so. That would
Yep.
be, it just kind of tells us where we're going. I'm great, thanks, Chair.
I just have a quick questions. So let's say that there's 4 people that go into a bar and there's somebody that witnesses one of their friends do something. What's the process? How do they do they come forward to the police if they had some information? They saw a friend do something and they come forward to you. You get something on record. How far does that statement go?
Anything that's reported anonymously, it's kind of hard to, you couldn't arrest on anonymous information, but it could give us a starting point for an investigation. And, okay, this was seen, well, there's cameras in the bar, let's go get the cameras, and go from there. It's definitely a starting point. But anonymously, it's hard to, you need something more than someone, you could build on it. It couldn't be something we could go arrest somebody for unless they were willing to testify to that fact that they saw it happen. If they're unwilling, then we'd have to get creative and, you know, go to get some video surveillance or talk to other people at the bar that may have seen the same thing.
Yeah, I'm just trying to say that this is a problem. Men, I do believe a lot of men don't like what's going on. We'll see this, and I want them to be able to come forward and feel comfortable with that. And that's a good place for them to if they're seeing this, we're all in this together.
Crime Stoppers, you phone Crime Stoppers, you can say, and you don't have to leave your name. You know, report it anonymously. This is what I've seen. If they know the person who did it or can describe them, at least we can get down to the bar or wherever the next day and get the video surveillance and go through it and watch it. But a week or 2 weeks or 2 months after the fact and all that's gone.
I think we have to do our, and that's, as I'm thinking here, I'm like, how can we look at, you know, being better and stopping this and making sure that, I think this was a big part today, so.
Yeah.
Is the committee okay? Is everybody okay right now? Okay, I'd like to thank our guests for coming in. This is an important 2 hours to talk about this. So what we'll do is we'll take a short break. It's more of a question, and a very short break just to clear the room, and then we'll come back and conclude the meeting. Thank you very much.
Thank you so much for your time today. This is super helpful.
Okay, we'll come back here to move on to number 4, which is discussion of scheduling. A notice will be going out very shortly for a meeting next Wednesday, December 15th, with Shelley Cole, representative of the Department of Social Development and Housing, on the topic of long-term planning for shelter beds. There was discussion last meeting about the Community Outreach Center. The working group has requested that their presentation be held in the new year due to availability, and this will be a presentation from a non-departmental member of the working group. So that's the latest update. Our clerk has been corresponding with both organizations. So just to update with you. So we'll book that with priority again in the new year. Do you want to add anything to that? Is that? No. That's good.
I think that's the first part of that story. So the meeting is going ahead on the 17th?
Yes, a notice, or no, sorry, excuse me, the 15th.
15th.
Next Wednesday.
Okay.
Okay? That's going to be with Shelley Cole, and that's about long-term planning for shelter beds, but that's the only thing she'll be presenting on. Okay? That was... Okay, thank you. Everybody okay? The committee has requested that the potential meeting next Friday, December 17th, with the Department of Justice and Public Safety be attended by the minister as well as representatives of the Crown Attorney's Office. Just letting the committee know that we have not yet received a response to this request. Okay. Noted? Okay, perfect. Sydney? That would have been where we're looking to bring them in December 17th.
Morning.
Morning. Yeah. Great. So at this time, just looking for any new business this time? No? Okay, great. And can I get a motion to adjourn? Carla Bernard today, not now. Okay. This meeting is adjourned.